So, hello everyone. Welcome to Metro Group of Hospitals Facebook Live session on oral health and hygiene. Today we are honored to have with us Dr. Sonia Khurana, a highly experienced and skilled dentist with over 2 decades of experience in the field. Dr. Khurana has been practicing at Metro Multispecialty Hospital in Noida since 2002, where she has developed the dental department into a state-of-the-art, multi-chair, highly specialized dental center. With her extensive expertise in cosmetic dentistry, repair of broken teeth, bad breath elimination, root canal therapy, and dentures, Dr. Khurana has become a leading authority in oral health care. Her passion for education, educating the public about dental hygiene, has led her to initiate school dental health awareness programs in prominent schools in Noida. In this session, Dr. Khurana will be sharing her insights on the importance of oral health and hygiene, as well as discussing the latest developments in the field. So sit back, relax, and get ready to learn from one of the most respected dental professional in the region. Hello, ma'am.
Hi, good afternoon, and what a topic you have chosen for the day. And let's look forward to the live session. How I can make overall health and the dental hygiene link important and contribute.
So, ma'am, my first question to you: how important is oral health for our overall health?
Yeah, that's the greatest question I was looking for today's session. Yes, of course, our general well-being is directly related to our oral health. Mouth is our entry to the body, and a healthy mouth is most important for a healthy body. The germ count in the mouth. We've already, all of us have gone through various protocols that were followed during COVID and various viral infections which were super added over the COVID. So we all know, that whenever we have a high germ count, a high infection rate inside the mouth, then we are exposed and more prone to certain pulmonary infections and people who have some cardiac issues also have a threat to various other valvular problems if our oral health is not good. So it is overall directly related, our general well-being is directly related to our oral health.
Okay, so ma'am, there are multiple things like how often should I brush? Should one brush and floss our teeth every day? And is there any specific toothpaste or toothbrush you want to recommend?
Brushing is the most basic requirement for maintenance of our oral health, and it is definitely recommended to brush after every meal, though it may not be possible when we are in the move or at work. But definitely, brushing twice daily is a must, morning and at bedtime. Of course, now we work, according to hours, not according to morning and evening. So I would say start of our day and end of the day, brushing is most important.
And what is the proper
And
way to? Yeah,
sorry.
yeah. So sorry. So what is the
You
proper way
asked
to?
how often we should brush and whether we should floss. Yes, flossing is also very important, and one must floss. Generally, it can be done anytime you require it, because flossing is removal of debris within the crevices of the teeth, in between the teeth, where the contacts are very tight and we don't. It's not practically possible for the toothbrush bristles to enter. So, floss is a waxed thread which is passed through or snap through or glide through the crevices of the teeth. But it is preferred to use it at bedtime, because that is the time when we want the debris to be out of the teeth and we don't want the bacterial count to be increasing overnight. So that nighttime or bedtime is the best time to floss. And there are no specific floss types or toothpaste that are recommended, but yes, wax floss is easier to use and feels light and smooth to glide, and a toothbrush should be generally very soft. A soft toothbrush is gentle on teeth and is able to clean all the tooth surfaces and does not cause abrasion. And as far as toothpaste is concerned, of course, there are multiple factors how you decide on a toothpaste. It should not be very abrasive. It should be able to eliminate bad breath, and it should have some fluoride content. And there is a wide variety of toothpaste which is available, different flavors, pediatric, adult, and all. So it's kind of individual, but I would say my experience, simpler the toothpaste, better it works.
Yeah. So, ma'am, next question is, what is the proper way to brush and floss teeth?
Okay, now brushing technique, yes, we generally do not pay too much attention to brushing technique, and we carry this thing that we brush more, we brush with more aggression and a longer time, then it cleans the teeth better. No, it's not like that. The idea is, the bottom line, that our toothbrush should reach all the teeth surfaces at least once, and we should definitely brush our tongue, because our tongue houses a lot of odor causing bacteria. So once we've cleaned our teeth, we must clean up our brush as well, our tongue as well, with the brush. So that is very important, and there are a lot of techniques which have been recommended for the brushing, but the most common is when we use a technique where we place the where we place the can you help, Ravi? I can show explain on a picture that we need to yeah, we can you increase the size here? Can we zoom? I'll just take a minute. I need to zoom this picture. Let's see how we do it. uh,
Ma'am, one second, let me just get into this.
yeah, because I can't see the top part of the picture here.
Yes,
If
try again now, ma'am. Just try to present the picture right.
it's not showing. Yeah, but can't zoom it. Wait. मुझे फोन कर दीजिए प्लीज. Yeah. So okay, so I don't know whatever you can see. Now, generally we place the brush at a angle of 45 degrees. It should lie 45 degrees on the tooth line and the gum line, and we move in a circular wiggling motion for the front teeth. And when we need to go for the back teeth, we move vertically up and down for upper, and up and down vertically for the lower teeth. Make sure that your brush also reaches the tooth surface, and at the end we brush our tongue as well. So this is a very basic brushing technique we generally should follow, and this is all done with a gentle motion. We don't have to kind of force our brush onto the teeth surface and run it aggressively. And the upper limit for brushing our teeth in terms of duration could be 2 minutes, but I generally, with my experience and the results I see, I feel that each tooth surface should be cleansed at least once or twice by the brush. Even if you're able to accomplish that in a minute, that's okay. That's really okay. And that's about it. And basic toothbrushing technique twice a day is sufficient.
Okay, so my next question to you is, ma'am, how often should I come for dental checkups and cleaning?
Usually recommended dental checkup is at least 6 months, 6 monthly, or up to maximum up to 1 year. But people who have existing dental problems or have undergone various dental treatments would, as recommended by their professional dentist, should visit more often. But 6 monthly is a must. And for maintenance of teeth, once a year, dental scaling, that is the ultrasonic scaling, should be performed. And I would say that the ultrasonic scaling is not just removal of plaque from the tooth surface. It actually now, it serves as a screening process, as a dental checkup, because there's a lot of dental problems which remain in our mouth dormant without any symptoms and generally go undetected till they are in a very advanced stage, which could be painful and more expensive and involve a lengthy dental treatment. So, other than dental checkups, every 6 months we must go for ultrasonic scaling by a dental professional every 6 months to 1 year.
Okay, ma'am. So my next question is, what are the signs and symptoms of gum disease, and how can I prevent it?
Well, there are several signs and symptoms, but the two basic symptoms which we look for and we should never ignore are bleeding gums and bad breath. Bleeding on, provocation, slightest provocation, like you're having something very hard like nuts or a guava or a seed, or just while brushing, if your gums are bleeding, that means they're not healthy. There's something wrong somewhere.
So, ma'am, next question is, are there any foods or drinks that are particularly bad for one's teeth?
I'm sorry, come again, Afan, I did not get the question.
Yeah, so are there any foods or drinks that are particularly bad for my teeth?
Yeah, yeah, there are definitely. Number one, soda. Do not have it. Other, I don't know how it affects. It definitely negatively affects the digestion. But yes, sodas are very harmful. Of course, you are having once in a while, it may not cause damage, but you are having frequently aerated drink sodas. They are definitely damaging to the tooth enamel. And other than that, citrus foods and certain abrasive foods and things which we used to use earlier, in dated times, and our people used to use very frequently these neem powders and certain abrasive mouthwash, toothpaste. They, if they are used long term, can cause abrasion to the teeth, definitely. And mouth fresheners like Soft and Supari, if they're taken regularly every day for years and years, they also can be harmful.
And what are the best ways to maintain fresh breath, ma'am?
Keep your mouth clean, brush regularly. As I mentioned earlier, also brush your tongue and brush at least twice and rinse after every meal. Try to cut down on your uh, you know high sugar meals, and of course I forgot to mention sugary foods are also not good. Sticky sugars, caramels and all, if you're having drinks which are sugary all the time, they can be harmful for the teeth, and they also cause bad breath. We tend to be working with on our laptop and sipping on coffee or tea with a lot of sugar, so these can cause bad breath also and can be harmful for our teeth.
Okay. So, are there any oral health issues that I may be at risk for based on my medical history?
Yes, there are a lot of oral health issues which are, related to a particular medical history. Let's start with most common diabetics. Not diabetics, all diabetics would have compromised oral health, but yes, if people are having long term uncontrolled sugars or some other damaging mm, damaging something like with diabetics, when they have uncontrolled sugars, their gums are more prone to infection. And in cardiac issues, when people are on long term anticoagulants, they could affect their gums. Then people who have undergone radiotherapy, their teeth, especially the upper head and neck region, they do have a lot of issues due to radiotherapy, and they are also having a lot of issues with the dryness of the mouth, and it tends to give them more. They're more prone to tooth decay than other individuals. So, and renal compromised patients or patients with liver diseases, they have a deranged clotting, factor flowchart. So they do have a lot of gum bleeding and other issues related to oral health. So there is a definite connection with your medical history. A lot of systemic diseases and long-term drugs. Maybe if somebody is on oral contraceptives for long term, or some steroids, or post a transplant. So these could give them a lot of gum swelling, and their gums are fragile. So all these people, their basic requirement is to maintain very good oral hygiene, which is an individual's requirement, basic requirement, when they have compromised systemic condition or a medical history or have undergone any surgery. So basic oral hygiene is of utmost importance, and regular dental checkups.
Okay, so ma'am, next question is what should I do if I experience tooth sensitivity, pain, or other dental problems?
Do not ignore any symptom related to your teeth. May it be some sensitivity to cold, or when you have some, even if you have a momentary pain or sensitivity to hot, please do not ignore. Visit your nearest dentist and get yourself checked. You may not need any elaborate treatment, but at least you would be safe from entering into a bigger problem. And one more very important advice: when you have these kind of symptoms, do not self medicate, because that could be worse, that could be very harmful. You would be suppressing a symptom of a bigger dental problem.
Okay, so ma'am, next question is how can I best care for my child's teeth and encourage good oral health hygiene habits?
That's something very important, and most of the time it's neglected. We have this, हिंदी में बोलूंगी, ये हमारी एक बहुत बड़ी धारणा है कि ये दूध के दांत हैं, ये टूट जाएंगे, ये तो नहीं चाहिए, परमानेंट दांत तो बाद में आएंगे, तो ब्रश करने की जरूरत नहीं है, बस बच्चे को दूध पिलाओ कुछ भी करके, और हम ये रोज देखते हैं। प्लीज ऐसा नहीं है। दूध के दांत बहुत ज्यादा इम्पोर्टेंट है, दो कारण से। एक इसलिए क्योंकि वो उस एज में है जब बच्चे को न्यूट्रिशन बहुत ज्यादा इम्पोर्टेंट है उसके ग्रोथ के लिए। दूसरा, अगर दूध के दांत हेल्दी होंगे तो परमानेंट दांत हेल्दी आएंगे, और ठीक समय पे आएंगे, ठीक जगह पे आएंगे। सो इट इज वेरी इंपॉर्टेंट टू मेंटेन अ चाइल्ड्स hygiene first thing, because up to 7 years, a child is not considered capable of brushing his or her own teeth properly. The parent or guardian is advised to brush their teeth with a smaller toothpaste, a safer toothpaste, a smaller toothbrush, and should be done at least twice a day. Never make your child sleep with milk or any other sugary drink or food in their mouth. They must brush before bedtime, whether it's day or whether it's night, and you must take your child for a dental checkup regularly.
Ma'am, next question is are there any another oral health concerns or topics that you would like to discuss?
Yeah, as I said, children oral health very close to my heart. I mentioned never neglect, do take utmost care. And second, Tobacco related dental problems, there are several. Nowadays we see the incidence of tobacco related precancerous and cancerous lesion increasing. So I would say it's very important that we must understand how tobacco or related products are causing various dental issues, certain lesions in the mouth, certain allergic reactions which are kind of incurable. So this needs to be addressed in detail, maybe in our next session.
Thank you so much, ma'am. So, for sharing your valuable time and expertise with us today. Your insights on oral health and hygiene have been enlightening and informative. We appreciate your efforts in educating the public on the importance of oral health, and we are sure that our viewers gained a lot of gained a lot from your expertise. To all our viewers, thank you for tuning into this session. We hope that you found it informative and useful. Remember to practice good oral health hygiene as it is crucial to maintain good oral health. That concludes today's session. Have a great day.
Thank you so much, and thank you so much for the for listeners. And keep smiling and keep your mouth healthy, healthy mind and healthy body and healthy mouth. Thank you.
Thank you.